Shut up. Hey, everybody. Karen Anderson right here with Aortic Hope for today's week in review. It's not a very big week, so I'm going to fill it in with a lot of stuff I feel like talking about because because I just feel like it, and I'll have somebody captured. Hopefully, people join now that your holidays are all over. I'm done eating matzah. You guys are done with Easter. We're done. We're moved on, right? You're new to this, bear with me in my insanity. This is our week in review. So we're going over all of the posts that we put up in the week prior. We're kind of talking about them, giving you guys a chance to interact through the chat button below, which is public, stays out there forever. So say nice things, giving you guys a chance to interact with me, tell me your thoughts and your opinions and comments. Um, and then we use this channel for so many things. If you're not already clicking like and clicking subscribe and hitting that bell to be notified every time we're going live, you're missing on a lot. This is where our live events take place, where we interview clinicians or attorneys and we have an open conversation with the community and give you a chance to ask questions. We also have our cooking demonstrations, our Qigong demonstrations, our aortic artist comes on here. There's so many things that take place. This is more than just a place where you can get some accurate educational information. This is a community. So this is a place where you can take your mind off of aortic disease. We're definitely doing something very unique, very one of a kind. And the way to be a part of it is click subscribe, click the bell. So do that now while I start with Monday, okay? Because that's what's happening. All right, it's Medical Monday, everybody. Oh, Sai. Sai loves to put up posts. Sai is one of our medical students. He loves to put up posts with lots of really big words to challenge me. Today might not be a great day to challenge me. We'll get to that in a minute. All right, this is what Sai says. Hello, Aortic Hope family. Welcome to yet another amazing Medical Monday. And last week, which was that today, we were talking about a simple yet incredibly effective tool that doctors use to treat patients that have atrial fibrillation, or otherwise known as AFib, or in really complicated terms, it is known as, and I shall read, CHA2 little 2 DS2 VAS little c score. And he says what I'm thinking. I know, the name sounds like a weird mix of algebraic variables and confusing medical acronyms, but this test that they perform is actually much easier to understand than you think. So let's get into it. What is AFib? What is atrial fibrillation? So this is a really simple diagram that explains. So this is your typical heart rhythm. You have your sinus node impulse and your AV node here, and all these electrical impulses go and give you this regular boom, 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 typical heartbeat, right? This is AFib. This is when you start getting irregular impulses in the different chambers of the heart, and it can look like this. Crazy mess, like the stock market. This is what it looks like. It's just insane, right? So, as you know, your heart has two upper chambers, right? You have two upper, one, two, got two lower. They're separated by valves, okay? And these chambers are called the atria, and the two lower chambers are called the ventricles. So you have your atrium, which is the above, the two upper chambers, and the ventricles are lower. And the heart has these unique sets of cells within its tissues that actually generate electrical impulses, and they set this steady heart rhythm. However, for patients that have atrial fibrillation, the electrical system does not seem to work as it's supposed to. It's a little screwy, and it can actually lead to the atria pumping in this rapid, chaotic rhythm, and it can make people feel like they have some chest pain. They might feel shortness of breath, could be some dizziness, could be irregular heart rhythm for sure. And the crazy thing is a lot of people, millions of people walk around every day experiencing what we would call palpitations. They experience these irregular moments of heart rhythms and they don't even know that they feel them. But then there's other people that can feel these irregular heartbeats. And these specifically, AFibs, can really make you feel a little caca. Okay. In addition, AFib can also lead to blood clots because the heart rhythm is off and has a little bit of a longer period of time where it's not moving. Believe it or not, any kind of blood that sits still for a period of time can form a clot. I mean, if you if you cut yourself, that blood really pretty instantly is already starting to form a clot unless you have a clotting issue. So when it's that irregular and it's just sitting there, it can potentially lead to blood clots, and that can actually travel to the brain, and that's what causes a stroke. So this is where that CH2 DS2 VASC score comes into play. Okay, I wish it was an easier name, and it's probably called Chad's Vax or Vasks or something. Who knows? This is how you determine the score. So this looks like it's showing a damaged part of the brain and the thrombus or blood clot that blocks the small vessels of the brain. This probably came off of AFib that happened in the left atrium. There was a larger clot there in the heart from the irregular rhythm that traveled up into the brain, and that's what it caused. So the score is this test that's used by doctors to assess how likely somebody with AFib is to actually suffer a stroke based on stroke risk factors. So this is really fun because now you get to know what all that CHADS VASCs means and stands for. So C stands for congestive heart failure. If you have congestive heart failure, I'm assuming you would get 1 point, okay? If you have hypertension, that would give you another point. If your age is 75 or older, you get 2 more points added onto that. See where this is going? If you have diabetes, you get another point. I'm actually keeping score for myself here. If you've had a stroke or a TIA, you get 2 more points added on. If you have vascular disease, that gives you a point. If you are between the ages of 65 and 74, that adds on yet another point. And if you are a female by birth, then in that sex category, you now have another point. So if you add up these points and you get a number between 0 and 9, with a higher score, indicating a greater risk for stroke and possibly a need for an anticoagulant. In my case, I scored a 4. So it's kind of seeming a little mid-range. I don't ask questions. My doctor put me on Eliquis because we thought I was having some AFib. And based upon, I guess, some of these scores I had above, it made sense. I just say, yes, please, thank you for a lot of things, because I am very trusting, and I know my family medical history, so I'm not about to argue with it. If I have questions, I definitely communicate that, and I try to educate myself, and that's how I advocate. Hence, I ace that healthcare journey. We'll talk about that another time. All right, so again, if you get a number between 0 and 9 with a higher score, that might indicate that you need to be on some type of anticoagulant. So an anticoagulant or blood thinning medication can really reduce or prevent blood clots that can prevent a stroke in a patient with AFib. Generally, men with a score of 0 and women with a score of 1 have a low risk for a stroke. Having a score of a 2 now has an intermediate risk for stroke and might be considered for an anticoagulant. Men with a score of 2 or women with a score of 3 or more are often at a moderate risk of stroke. So anticoagulation medication is recommended. For myself, I can say I have been on so many tests, and I think that it has not been definitively determined that I have a continuous AFib. I had it once or twice caught by a watch, but I am probably now more on on Eliquis to rule out any chance of having any future TIAs or strokes because I've had one, versus to prohibit me from having a stroke because I have AFib, because I really don't have AFib. So final thoughts, the score that we talked about is really the crucial test that is incredibly helpful in determining the stroke risk in patients that have AFib. So that can really help lead to this early intervention when it comes to anticoagulation medication. So while it might be scary to think about using a blood thinning medication, I get it. I really do get it. It's really, really important that these medications can, because they have such a profound effect in helping somebody be able to lead a healthy, stroke-free life and enhancing the quality and longevity of your life. So thank you, Sai, for educating us on one of the most important reasons why people take blood thinning medication and anticoagulants, really just the anticoagulants, because of that potential of having a higher score and having AFib. Such interesting and so important. I don't know really if that's ever been explained before. I love learning. I love things that are new. So if you have questions about this, I am not a medical professional. I just pretend to play one on TV. Definitely talk about the score. Ask about that Chad's score. Ask how you would score. Take a look at this. If you came up with a higher number and you are concerned or nervous, talk to your physician and have that conversation. And that's your Medical Monday.
Excellent
Who's with
work.
us? Thank you. Thank you very much.
We've got
Who's with us?
Christina and Velda and Molly and Tom.
Oh my. It's like a fan club. Hi, guys. Thanks for joining me. I get to tell you about why I'm so insane soon. The more crazy I get, the more moments I have when I'm going to share with you, the more I actually end up making myself laugh when I think about how cray I was a few hours ago. It's just moments in time that pass where I wasted so much time being infuriated about something so stupid, but in the moment I'm so cuckoo that I can't get a grip. I can't wait to tell you the story. We'll do it after Topic Tuesday. Let's get through this before I unleash a fury. All right, Topic Tuesday. This one's for Molly. We're going to talk about the zones of the aorta. So such exciting things happened with the aorta, you guys. It happened, what is this year? This is 25, last year's 24. When was I in Scotland? Last year, right? I think it was right before we went to Scotland. This big to-do happened and the aorta was granted to be its own organ. Its own organ. And there's some really, really key critical reasons why it's its own organ. And being an organ, it has all these different zones. And interestingly enough, different zones can be diagnosed differently, monitored differently, treated differently. And so it's an organ in that sense. It's still a vessel, but it is very independent of your heart. So, it gets to this point, it's kind of like when everybody's like, oh, you had a heart attack. No, didn't have a heart attack. So you have a bad heart. Nope, don't have a bad heart. It's separate. It's the aorta. And so it is hard. It's challenging to educate people. But let's talk again about the aorta. So it is that main artery that takes all of the oxygenated blood that has just come out of the lungs and pushes it all the way through and feeds all that blood to the rest of your entire body. It is an extremely critical vessel. So because it contains so much blood and it does so much work, the physicians really needed to find this identifying way of looking at the different areas and regions of the aorta. And that's kind of where the classification system came in. So many things. Look how exciting. I think it's so fascinating and exciting, right? All these different zones. You basically have 11 different zones. So you have your aortic root, which is right where your valve is. And then we begin zone 0. So anytime zone 0 is referred to, that is your ascending aorta. It is zone 0. And you have the innominate artery to the left carotid. These are what is coming off of that area. Zone 1 is actually where the left common carotid artery is. That is anywhere from the innominate artery to the left and including the left carotid artery. Because remember, you have 3 branches coming off of your arch that take blood to your brain, take blood to your arms, okay? Zone 2 is anything after the left common carotid to the left subclavian artery, the LSA. And including. So it's after LCC, but including the LSA. That is zone 2. Zone 3 is the first 2 centimeters of the distal area to the LSA. And that, again, is the left subclavian artery. So this is like 2 centimeters worth. But it is given its own area because you're now beginning the descending thoracic aorta, but you're off of the arch. So now we're into a little bit less danger zone, a little bit less, you guys, a little bit. Zone 4, big area, kind of as big, a little bit smaller than your ascending. Zone 4 is going to be everything after zone 3. And that is going to take you to the mid descending aorta. This is actually mid chest level, mid descending aorta. And then zone 5 is again picking up at the mid descending aorta to the celiac artery, right above the celiac artery, just a smidge below your diaphragm. Celiac artery tells me that you're abdominal. Why would I know this? Because people have celiac disease. So I put the two together and realized that you're abdominal, right? That's going to be those organs in there. Um, it's not that I'm genius. It's that I don't know, I somehow figured it out and retained it, right? So 6 is going to be the actual celiac artery to the superior mesenteric artery. So include your celiac and just before you get to the superior mesenteric artery. Do not ask me what that one feeds. I still think we're in the same area because I just do not remember. All right. All of that area is in zone 7. So zone 7 stops zone 8 begins right after the superior mesenteric artery, and it includes your renal arteries. Renal's going to be to the kidneys. Kidneys. I think I'm correct. Take you right out to your kidneys. If I'm not correct, it was a decent guess. All right, 9. Oh, and zone 8 also is the renal to the infrarenal abdominal aortic area. So now you're at 9 and you are in the infrarenal abdominal aortic area. Okay, that is like in your belly. That's where that artery sits. Okay, now 10 is right underneath that, and it's right where it splits into 2 of the common iliac arteries. That is the beginning of it going down into your legs. And your 11 is the same continuing area, but it includes the external iliac arteries. Where that leads to, I don't know, someplace down below. But this these are your zones. And it is treated differently because if you had a small dissection, let's say in your common iliac artery, depending on its severity, would determine if you had a little baby stent. They're not going to cut you up in that area as a first means of treatment as they would in the ascending. So treatments are different, right? You're not going to have an ultrasound like you would an echo to view the iliac arteries, not necessarily as a first choice, or maybe it would be as a first choice. It's because the CT scans are still so good, right? So is a cardiac MRI. Still good, but you would need to include the pelvic area, abdominal and pelvic. So it would be a different test. It wouldn't be the chest, it would be pelvic abdominal, right? So there's different forms of treatment. Will you be on a heavy duty beta blocker? Not necessarily. I don't know because you don't have the same volume of blood as you go down lower into the aorta. So there's so many questions and variables that to make it easier, yes, we still go by the standard type A or type B or type 1 or type 2, depending if you're DeBakey or Stanford and you're discussing the dissection types. But when discussing, again, diagnosis, treatment, et cetera, you are looking more into zones at this point. So the following are the high yield zones of the aorta, which we talked about. And these are the areas that might need surgical replacement, like we discussed. So that again was zone 0, and that started from the aortic root, traveled up to the first head vessel, which is the innominate artery. And that artery actually supplies that oxygen-rich blood to the right side of your brain and your arm, right in here. Right side of brain, right arm. And you have to remember, it does not sit in your chest like this, or that would mean it goes around the heart. This goes actually up and behind the heart. So when you look at the arch, you're looking at it straight on, not sideways, but we do it to make it easier in the picture. So zone 0, it's an emergency. This has to be addressed, probably surgical. Zone 1 travels from the innominate artery, which is right side head, right arm, to the left common carotid, which supplies the left side of the brain. We just talked about that. Okay. High yield area. Zone 2 goes from the left common carotid artery to the left subclavian artery, which gives off arteries that supply your chest wall, your left arm, and your left brain. High volume, high priority. Okay, 0, 1, 2. Big deals. Here we go. So this is another diagram. This is your arch of your aorta. We are now in the ascending zone 0 to zone 1, zone 1 to 2, 2 to 3. This is your descending. Okay, subclavians, yellow, common carotid are the greens, and this is the brachiocephalic trunk. I don't know if I'm saying these right. I think I am. So zone 3, which we talked about, marks that transition point to the descending aorta. Zone 6 through 8, it's the visceral branches, the veins, the visceral branches. So these are the arteries that come off that supply the organs in your abdomen. So 6, celiac, I was right. It not only does the stomach, but it does the liver, does the spleen, does the gallbladder, small intestine, pancreas. Zone 7, we're up here. Okay, this whole area right here in the abdominal. Zone 7, the superior mesenteric, supplies the small intestine and the large intestine. And then 8 is the renal, and that does do the kidneys. Okay, so this is a crazy diagram, rights and lefts, and everything that it supplies, all the way into your iliac and into your femoral arteries. Zone 10 is the area where the aorta separates, which we talked about, into the iliac, and that is what supplies your legs. And then the blood supply to the groin and the pelvic area, the lower extremities, the reproductive organs, etc. It's a lot. This was originally posted by Adam, and I think it just makes sense to pop this in every now and then, whether we're talking about medications, whether we're talking about valves and treatment. Every now and then we just got to go back to basics and just say, let's talk about the entire aorta. And I think one of the things, again, another thing that we do different here versus other organizations is we have recognized that there is really no difference between zone 0 and zone 10 other than the potential loss of life if there were a dissection or a rupture. You can have a dissection in zone 10 and still get one in zone 0. It doesn't have to be the other way around. You give an aneurysm form in zone 3 and then pop up in zone 6 because it's still an organ. It's like saying, well, I have something wrong with my right kidney. I can never have something wrong with my left. Of course not. Or I have something wrong on the, posterior part of my kidney, but not the anterior. Well, that makes no sense. It's one organ. Of course you can. So there is no reason in our mind to focus solely on just zones 0, 1, and 2, because if you have it someplace else, you could very well have it happen there. So that's just our belief. We feel that everybody should become very knowledgeable of your entire aorta, because once it's compromised, it is compromised, and there's never this 100% guarantee that nothing else can ever go wrong. That's my soapbox. I've now just stepped off. There you go. Indicate what kind of day I'm having. But no, in all honesty, that's your topic Tuesday. I think that's just such a great post, and I'm so happy that it was shared.
Excellent. Bruce has joined the chat.
Hey, Bruce. Bruce is getting ready to have another dine and donate at his local Texas Roadhouse.
O'Rourke.
It is a different Bruce.
It's a different Bruce.
Okay,
Molly
but if
says,
it were Bruce,
totally off subject. Do you have any recommendations for a good self-tanner?
Yes, I do. I actually can hook you up with one. I like the product by New Skin. I've used it on myself a lot. It is instantaneous, doesn't stain your hands, won't stain your nails. You don't need to pre-cover them or anything. It's instantaneous color. If you wait like another 5 minutes, it gets a little bit darker. By the next day, it's even darker. It's very even, no need for a mitt. Just kind of put it on. You can see where you're going. It kind of still smells like you've been in a tanning bed a little bit, but I like it. And then I recently had a spray tan, and I fell absolutely in love with that. I think there's nothing better than just going in and letting somebody airbrush you perfectly. It was a great experience. It was like $35. You can pay $5 more to have it develop its color quicker, like within 4 hours. It was full in its coverage, and and nobody could tell. So that was kind of cool too. So either one, if you want new skin, shoot me a message. Otherwise, look for like a local spray tanner person in your area. I think it's worth it for sure. But you got to wear sunscreen. Got to wear sunscreen. Don't forget, you're not really tan. But you should wear sunscreen all the time anyway. So
Christina
good
says,
question.
my dissection starts in zone 2. Radiologist called it a type A. I guess he needs a copy
It
of
is.
this Facebook page.
Well, so if it started in zone 2, if it anything that is before you get to the descending, they can, oh, so he called it zone 2. Interesting. I guess it would depend if it was on its way down or closer to the 1. If it was closer to the 3, I get where he was coming from. If it was closer to the 1,
I mean,
does it really matter?
My understanding was the 3 branches were all part of the ascending, and it was everything after the 3
Yeah.
branches that was descending.
Yeah. Well, that's a type 2, which is interesting because now that we use that classification from DeBakey of A and B, I forgot what Stanford 1, 2, and 3 stands for. So you might want to look that up just to be sure before you give them a schooling. Because I don't remember. It's too much information in my head. All right. I'm just letting you guys know we have another sale coming up. Starts May 21st, goes through the 28th. We'll be talking about this a little bit. So did I say that right? Did I put the wrong dates? No, I think I put the right dates. I'm pretty sure I put the wrong date because I was so excited to tell you. It actually starts on the 24th. Starts on the 24th, not the 21st. But there is still a sale going on right now today. It should end today and then picks back up again on the 24th. So you should take a look and see if it says. Regardless, today, 24th, it's happening, 20% off everything in the shop. This is a great time of year to pick up t-shirts, tank tops, baseball caps, any kind of swag that you're thinking about. We have Father's Day coming up, we have Mother's Day coming up, birthdays, graduations, whatever, gifts for your doctor to say thank you. It's all on there. This is the time you don't want to delay. You want to grab some of that swag. I am going to get myself a tie-dye shirt because I love tie-dye and I need another one. Yeah. So check that out. All you have to do is if you go under Hope Shops, what you're going to see is our shop right here, Aortic Hope Shop My Spread Shop. And you click on that and there's a redeem button at the top. Just click it, it puts it in for the whole cart. Okay. So that is that day. All right. Let's talk about Survivor Series featuring Scott Hunter. I'm going to read some of this and then you guys need to check this out. All right. Scott Hunter, type A aortic dissection survivor. Thanksgiving Day. This was Thanksgiving Day almost 3 years ago, so 2.5 years ago in 2022. He had a type A dissection and obviously an emergency open heart surgery. About a year later, like in 23, he had another open heart surgery for a much more complete aortic repair, so probably a lot more complicated as well. This was his valve, which he chose bovine, which to those that don't understand, that is going to be a tissue valve. So it's going to be your cow valve. I had to think real quick, your cow valve, which doesn't mean a valve that came out of a cow. That's not what it means. It's just tissue, and they utilize that tissue to create a valve that you can do endovascularly because it's not mechanical. But in his other open heart surgery, he had this valve replaced. He had ascending replaced, arch replaced, descending, basically the frozen elephant trunk procedure. Had all that done. 6 weeks later, he had an endovascular repair done to attach a stent to the bottom of that FET and to wrap around the iliacs with like that wire, not the graft material. It's just a stent, basically. That's a lot. Like I'm trying to wrap my brain around everything I'm reading that happened so quickly. During that frozen elephant trunk procedure, his lungs collapsed and accelerated his pulmonary fibrosis that he already had. He left Cleveland having to remain on oxygen, and his oxygen requirements started growing pretty quickly. So he returned to Cleveland in May of 23 for a double lung transplant. And we worry sometimes about having a colonoscopy. So this shows you that yes, you can have anesthesia, you can have other procedures. There's a cost benefit analysis thing that happens, and he needed to have a double lung transplant. I mean that's amazing, and he's here to tell the tale. And there were complications from this, which is crazy. He was in the hospital for 5 months, and it's been 11 months since the double lung transplant, and he's still recovering. This is incredible. Amazing. So, yeah, yeah, pretty incredible story. We want you to be the next person that we can say pretty incredible story about. We want you to be that shining star in someone's life. We want you to submit your story because you know what? Gosh, when I read these stories or I listen to these stories, I don't know, the first thing it does is just it sheds perspective in my own brain, my own whininess and my own life. And I know none of it's a competition, but it really does give you a moment to reflect and think about what happened to somebody else. And kind of fuels my fire a little bit to stay on top of my own health issues. And all I can say is I really just wish him nothing but the best and continued success in his recovery. It's not about speed. It's about that you just achieve your own personal quality of life. But we want you to do the same. We want you to share your story. You will find it very therapeutic to be able to share, knowing that it's validating so many other people as they listen and they read your story. We want to know, what were the symptoms that you experienced? How were you diagnosed? Were you sent home? Were you immediately given the right scans? These things are important. We'll probably share it with Think Aorta US because they're a very pre-active organization, and they kind of help to educate the physicians and the med students about some of these things that get missed or the success stories and when nobody gets missed, right? So there's a form. We want you to fill that out and someone will be in touch with you. You can do it one of three ways. You can written form, you can pre-record, and you can go live like I am here, so you can take questions from the community. So consider being our next Survivor Series guest, featured person, star, Survivor Series star. All right, that's that one. Am I supposed to tell my story now? Yeah, lead up. Let me tell you guys. Let's see if you guys can relate. I swear, I'd like to think it's menopausal brain, which I've heard about this. Look, I'm full blown. I get it. Sweats, flashes, I get it. But I went for a little breakfast this morning because I could not get in for my blood work okay, let's back it up. I scheduled blood work. I thought I scheduled blood work, but clearly did not click like the very last button that makes it scheduled. So I'm sitting and I'm sitting and I'm sitting for like a half hour checking my texts and emails and realize I never scheduled it. Didn't schedule it. So as I'm sitting there, I schedule it for Friday and I'm still cool, calm and collected. I'm fine. I'm just going to go get a little bagel, a little eggy. I go to the restaurant, I'm sitting, and I realize there's a certain medication that I have not been approved for by insurance. And I know that my physician has submitted two like determination letter things and authorization things, and I'm still waiting. It's been a month. And I get online with Humana, that's my company, and they're like, "We can't find you. Do you have your card number?" I'm like, "Well, I don't have my card, but I can go look it up right now on my Medicare." She's like, "Oh, well, let me have your Medicare number." And I give it to her. She can't find me. And I find the Humana. She can't find me. Let me put you into another department. Doesn't put me in the right department. I hang up because I'm frustrated. Now, this is what threw me over. Okay. You call in. Call in. Push one if you speak English. I'm already in a bad mood because I got to push a button and I'm already starting to scream into the phone. Representative. If you could hear my recordings on these phone calls with these types of systems, it would make great comedy. I'm sure that it would. So I push one, then I get the representative and I tell this poor guy my situation. And he says, "I would very much like to help you with this." I'm like, "I'm so glad that you would like to help me with this, right?" I'm telling you everything that I say. And he says to me, "We do not see any forms from your provider." I said, "Well, this is near impossible because I know that they have sent it out twice because I see the confirmation in my portal. So please, please tell me the fax number. Tell me where they need to send this form so I can ensure that it is received by your company. To which I get, well, I cannot give you that information. Your physician knows what to do. And I said to this man, I'm not angry with you. I'm not angry with you, but I want to make sure I understand you. You want me to call them and say, I know you've sent it twice, but they said that you know what to do and do it again. I said, I got one better for you. I'm going to have them send this form to you today and every day this week before 10 a.m. Every single day. I'm going to make sure you get 5 forms. And then I better have my medication ready for me next week because this is utterly ridiculous. I just want my medication. And he says, I'm going to help you and put you on hold. No, 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 no. Disconnected, disconnected. Now I am shaking so bad and I want to like cry because I'm so angry because not because I want to cry, I want to cry because I want to break something, but I don't want to hurt myself and I don't want to hurt anybody else. I just want to hurt something. And then I'm sitting there and the more I think about how I'm reacting and behaving, the more irritated I'm getting. And it's becoming out of control. And I'm just sitting there thinking, do I still have to go to the hospital? Maybe I need to get some medication. Like, I don't know what I'm doing. I think I'm losing my mind. But I don't want to call anybody and say, I need help. So I went to the bathroom and I cried for a minute. And I kept thinking, I think I really need some help. Like, I think I'm losing it. And I did finally reach out to my sister and she starts talking and she's like, what's up? And I tell her the story and I am much worse than I am right now. I am yelling. I am losing. She's like, okay, I think you're losing your mind just a little bit, just a little bit. I think that you should go home and have some chocolate and just calm down. She's trying her best. And was just, it's just, I hate calling customer service. I hate when they answer the phone and I have to sit there and I have to say representative 1,000 times or customer service because, and I've learned you need to get through to somebody. Just call the accounts receivable department because they will always take your phone because they think you're about to give them money. And then you just pretend, how did I get to this department? Please put me in touch with the right person. I mean, I really thought I was going to lose my mind. I'm still rattled. I'm still rattled by my reaction more than the fact. I think it's also because I can't control it and I get my way. I always get my way. The fact that I still don't have medication in my hand and it's been a month is literally driving me up a wall and making me insane. And I try to just get calm and just say, there's nothing I can do. This is so annoying. I've used this terminology before specifically in describing someone, but it really fits. It is as annoying women as a skin tag under the bra strap. It's annoying. This is annoying. This is causing mental annoying. And then I go to, it must be menopause. And why is the name menopause? Why does it have to have the word men in it? It's a whole other conversation that just infuriates me. I just don't want to talk about it. I'm done. I guess I can't talk about it anymore because I will just forget what day I'm on. And we're about to have a happy Easter post. So, you know, I cannot adult anymore today. I can't do any more scheduling fences, scheduling fans to come into the house. I can't do it. I can't even go to the dry cleaner. I cannot do any more today. I cannot do. I cannot do anymore. That's where I'm at. That's my day. I don't even want to cook dinner. I don't want to have any expectations. I just want to shed everything and just watch meaningless TV. Just,
You're out of
mm.
spoons.
I am so out of spoons. I can't even have, I don't have room to use a plastic spoon. I am down to Neanderthal, scooping the stuff. I'm trying not to curse. I'm really trying. Just scooping it with my mouth. And I'm missing my mouth, Josh. That's how bad it is today. I'm like, where did it go? That's what I have to say. And I would go to a Wreck-It room. I almost drove to a Wreck-It room so I could just break plates. But then I thought, I'm going to make my blood pressure rise and my heart rate's going to rise. And I can't even do that. But I want to smash something. It's like that scene out of Terms of Endearment. When they're like, here, hit Weezer. We'll sell T-shirts that said, I slapped Weezer Boudreaux, whatever her name is. And then that makes me laugh. I can't. I'm done. Such a Monday. It's so Monday, but it wasn't Monday yesterday. Yesterday was Easter, and I hope everyone had a lovely, happy Easter. I celebrate Passover. I had no matzah. You know why? Because matzah constipates you. I'm just going to say it like it is. This is a very hard holiday when you want to be a good Jew because you really have to take everything out of the cabinets and make it all kosher for Passover. And you can't eat enough. There's too much matzah. I don't know how they did it for 40 years in the desert following Moses. They must have all had stomach aches. And you know, half those Ashkenazi Jews had Crohn's or colitis. They all did. They passed it down. How did they eat all that matzah? So much matzah, so many carbs, so bad for you. I can't celebrate that holiday anymore. I think I'm okay. I think I'm still okay. I think I'll be okay. So I helped my neighbor find her eggs, and that was fun. So I had fun with her and finding eggs in her front lawn. I know. I don't know what's wrong with me. I'm telling you, I'm schwitzing right now. I'm very hot. But I hope all of you that celebrated had a lovely holiday. I really, really do. I do. All right. Does anybody have anything to say? Because if not, I'm going on to events. Is everybody making fun of me? You can laugh
keep
with
on
me.
keeping on. They might just be in shock.
I'm losing my mind and that this is going to stay out there in perpetuity. Don't you have to spell perpetuity? Why does there got to be words created that have more than 2 syllables and have weirdness when it comes to spelling them? I don't know. That's a whole other topic. See, that's what I should have my own show. I have topics about topics. It can create a topic about a topic that I want to make be a topic. Okay, events, guys. April. But we have a really great event. We have a great event tonight, and I put this out of order, but it's fine. 7 p.m. Dr. Kyle U. Daly. He's so sweet. He's so nice. He's coming on with us. He's from the University of Alabama, Birmingham, and he will be on tonight talking about everything aorta, things that he might have going on, latest and greatest, and stuff like that. So please come and bring your questions. Bring your questions. Otherwise, I'm going to have to talk about me, and he's going to think I'm an insane woman. So bring your questions. 7 p.m. Eastern. You can put them right there in the chat. Matter of fact, you should click the bell now, and then you'll be notified when we go live today at 7 p.m. I will be much calmer. I guarantee it. And we are going to talk about everything and anything. We're going to talk about zones. We're going to talk about it all. So questions, great. Just remember, take it grain of salt. His advice is his advice. Definitely use it as a conversation point between you and your own physician. If you want to remain anonymous, when you click on the link in the events page, there is a link to an anonymous form where you can put your questions in there, and then we'll ask them for you. Okay, so that's tonight. Tomorrow night, community member Amber Williams, who had a dissection. I'm pretty sure she's had more than one surgery at this point in time. Very athletic. She's going to be talking about her journey with aortic athletes with Carmen, David, and Jack Crow. That's tomorrow night. I think we have a guest. Pretty sure we have a guest, and I'm pretty sure it's Mindy Seltzer. I have to have that confirmed this week with John Quick. So it'll be interesting again to listen to someone's perspective about, and I thought Kevin's was great last week or the other day. I think someone's perspective about how they handle things and what their emotional and mental perspective is with aortic disease. It's so different. All of our physical stories are shared all the time, but we don't necessarily talk about, our emotions and what we experienced that way. And so this is a new twist on the Therapeutic Thursday show. Looks like we've got a little peeky poo. For Saturday, we might have a live event at 7 p.m. That bell will let you know if you should hop on with community member Jason Beatty telling his story live. That's what it looks like is happening. I think I'm reading it correctly. And then we are wrapping up this month outside of our normal, regularly scheduled programs. We will have Dr. Amy Klump. She just goes by Amy Klump. She's a doctor of physical therapy. We will be on the scene with Amy in the office at the physical therapy location part of MedStar Health, talking about why PT in addition to or in place of cardiac rehab, because not everybody gets cardiac rehab. So if you don't, highly recommend physical therapy. I actually did both and I highly recommend both. So we're going to learn a lot about what happens, what should happen, your expectations, their expectations, etc., and the differences, pros, or any potential cons. Look, you guys, I'm on a roll. I have gotten up the majority of May. Great things are happening. We've got Aortic Kitchen, Celebrating Moms, coming up May 1st. That is going to be interesting. We'll see what they've got doing. Hopefully we see Mindy just sitting there with her feet up, relaxing as Chef Rob cooks for her. We have a Cinco de Mayo bingo on Cinco de Mayo. Wear a sombrero, you get a prize. All right. We also have, let's see, another Aortic Kitchen with Rob and Mindy, and that is all about honey and tea. And guess incorporating honey and tea, or maybe we're making honey and tea. I'm not sure. We're going to find out because I have no idea. And then I would also like to announce that new name, Caregiver Connections. Caregiver Connections. It's taking place of the title Caregiver Support Group. We're changing the name a little bit. We're changing it up because really what happens in that support group meeting is more of a connection. Caregivers they have a whole different set of needs, very different than the patients, and they're more connecting with each other. We may also have another change. We may be moving our first Monday at 10 p.m. to the second Wednesday at 10 p.m. That is probably going to happen. We'll keep you guys posted. We'll have a nice post up about that if it's possible for it to do this. We also have a live event with Dr. Jita Hajar. She is from Canada. She runs the Lois Dietz Foundation in Canada. And we're going to have her on, and I will be co-hosting with Velda, which is so exciting. We're both going to be doing this, tag teaming this on the 20th. We do have an aortic artist following that on the 21st, where we are going to be painting rocks. And the reason I do like this one is because when you paint a rock and you leave it somewhere, I guarantee you will bring joy to somebody's day. Because every time I find painted rocks, it makes me stop. I see kids stopping, they pick them up. Usually the parents say, okay, we'll find a fun place to drop it someplace else so someone else can find it. Nothing bad happens when you find a painted rock. I promise you, you will make somebody's day a little bit brighter. And we are canceling the WISE, the Women Inspiring Support, and I can't remember the rest of the name right now. My head hurts. Support. Yep. Can't remember. Empowerment. I don't know. I created the acronym. I can't remember. That's being canceled because it falls on Memorial Day, and our host will be probably barbecuing, as she should be that night. All right. So that's what we've got. Still looking to clean that up. That is those events. And before we go, I have to give a shout out to our sponsor of this week's week in review, and that is Rock from the Heart. So if you have not attended a Rock from the Heart event, this is your chance to do so because you don't even have to go in person. If you're looking for the connection and the education, connect with them and you can be part of their aortic ed sessions because they are going to be live streaming everything. You can register. See that? I'm right on their page underneath of details. You can register there for in-person or virtual. If you are going to be in person, then you also want to consider signing up for the Saturday night concert with Sebastian Bach. He is so all over aortic disease. He's such a great supporter of the community and of Rock from the Heart. So get a chance and sign up for that. Looks like the hotel has sold out for their special rate. So you will have to find something that's close by, but I mean, I haven't been to North Dakota. I haven't been to Fargo, but I hear amazing things about it. And I'm sure there's other places to stay within walking distance of the venue. So check that out. Thank you, Rock from the Heart, again, for being our sponsor. And yeah, that's what I got. That is all I have. That's it.
Molly says,
Yeah.
my goodness, go take a nap.
No. Do you know, I went to the other house with my mom Wednesday. We had so much to do Wednesday, Thursday, Friday. And then my husband came on Saturday and I came on Sunday. And so I slept really, really well one night. And I was getting grouchy towards the end. It's just a lot. It's a lot of work, right? And I wasn't sleeping really well. And yesterday I came home at like 3 o'clock after dropping off my mom and took her to the store and stuff and slept for 4 hours. And then after eating something quick for dinner, I was in bed by 11 and slept until 8 o'clock this morning. Yeah. Yeah.
Rare.
When I crash, I mean I crash
Yeah,
hard.
that's rare for you.
I know.
Bruce
Yeah, but it was
says,
good.
I melt down much worse all of the time. You seem fine to me.
You should have seen me a few hours ago, Bruce.
I can't
Well,
imagine
yeah,
Bruce melting down, to be honest.
I can't imagine. It's hard for me to imagine anybody melting down. Like if I think about anybody, that's not true. There's a couple people I think in the community. I'm like, yeah, I think I can totally picture that, but very few. Like most people, if I think about them melting down, I think I would probably giggle if I was around them. Do you know what I mean? Like whenever Terry and I are together, and it looks like one of us is getting a little snippety, I think the other one just kind of either falls back while we're walking, or someone speeds up, and we just know just to we just pretend they're not there until they get their act together. Like we're supportive in spirit. And we just stay out of the way. This was yeah, this was ugh, it's bad. Felt bad, you know,
Hmm.
but it happens, right? I'm better now. I'll probably forget about it tomorrow morning. I'll wake up and be like, what was I upset about yesterday?
Well,
Who do I have to call today?
if you're going to need that power nap before tonight, you need to
Oh my
think about that.
gosh. Yeah. I have to be back on in 3 hours.
Yep, 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 yep.
Well, all right, guys, click that bell, click like, click subscribe. Please click share. That's also really important because sharing is caring, and that's part of my name. No, I don't know where that came from. Sharing's important. Somebody else is going to find something that we shared today very interesting, and it'll be because you shared it. So go ahead and do that, and hopefully I'll see some of you, if not all of you, tonight at 7 p.m. with Dr. U Daly. I'm so looking forward to it. See you guys later tonight. If not, I'll see you soon. Thanks so much. Take care. I'm such a dork.